I actually had no idea that my dad was suffering from any sort of addiction.
Lansing, the capital, the heart of Michigan, but also the battleground for an epidemic.
I think that it's a problem in the United States. I think that the problem has gotten a lot worse.
Fentanyl, Vicodin, morphine, and other opioids are used medicinally by doctors across the nation, but in some cases that medication becomes a crippling addiction that can cost a life. Taylor Colacchio lost her father 4 years ago to an overdose from heroin.
I think that it's absolutely ridiculous, and I think that that should be 100% illegal and something that should not be going on.
She says it was a result of his addiction to opioids prescribed by his doctors after a back surgery.
These doctors are giving these opioids to people and then sometimes even cutting them off dry like they did my dad, and then he ended up having to, go to heroin. So.
Colacchio still grieves every day, even after 4 years, wishing she could have done something to save her father's life.
I wanted that chance to stop it, but I didn't get that chance.
Ashley Myers, a nurse educator at Sparrow Hospital, is aware of the power of opioids, but believes banning them completely is just not practical.
Not always can we control pain by use of things like non-opioids like Tylenol or NSAIDs. So if a patient's coming in for surgery, I don't think that often Tylenol is going to be enough. But we do maximize our non-opioid modalities before adding an opioid in.
2 years ago here at Sparrow Hospital, Craig Havican and his team developed the Opioid Safety Score, designed to evaluate a patient's risk level to help prevent addiction.
With the opioid crisis, we know that there's also a large risk for patients to have adverse reactions to opioids while they're in the hospital. So what we attempted to do is to come up with a way to notify the nurse when the patient's risk became too great.
Since being implemented in 2015, Havican and Myers said the opioid scoring system has brought noticeable change to Sparrow Hospital, and with it, a sense of optimism.
We've decreased by about a third overall, and although this is a relatively uncommon incident, about 5 patients less per month are experiencing an sedation adverse event.
With the progress they've seen, Havican wants to send a reminder to the community that Sparrow is fighting alongside them.
The hospitals are aware that there is an issue and that we are looking out for their best interest and providing them the best care that we can.
And while nothing will bring her father back, Colacchio finds comfort in knowing someone is trying to help the epidemic.
Everybody goes through something in their life that changes them, to make them a better person. And so for me, that was definitely it.
In Lansing, Brittany Flowers, Focal Point News.